welcome to our Monday Minute. It's Thanksgiving week. Hopefully you haven't skipped straight from Halloween to Christmas. And we'll have a fabulous week celebrating Thanksgiving this week with your families and friends. We always have something to truly be thankful for, no matter how bad times may seem. Here at Healthcare Provider Solutions, we are all thankful for you as healthcare providers for continuing to care for patients in these rocky times at best. Thank you all. And again, I hope you have a fabulous Thanksgiving week. The discussion today in our Monday Minute is surrounding value-based purchasing and home health that is set to begin in January of 2023. Two specific things I want to share with you and emphasize. The first is that they did finalize in the final rule for 2023 that the baseline year for the model and for agencies will be 2022. In the final rule last year, they had finalized that the baseline year would be 2019. They have now changed that to 2022. And honestly, this should be beneficial for agencies because I think most would agree that we likely had better outcomes in 2019 than we did in 2022 based on the last 2 years, almost 3, of the public health emergency. That being said, we definitely want to use a year where outcomes were not so great. So as we continue to improve in 2023 and beyond, it'll be compared to a year that wasn't that great. Hopefully that made sense. In addition to that, I also want to make sure everyone is aware that they have issued the pre-implementation performance reports. Each and every individual provider number has its own. They have been uploaded into the iKey system where you will be obtaining all value-based purchasing reports. That is the system where you currently transmit OASIS to the database, collect your CASPER reports, etc. In that pre-implementation performance report, it has given you where you are currently compared to the other agencies in your cohort, with data through June of 2022 for OASIS and through March of 2022 for HH CAPS. So you'll want to make sure to check out those reports. It is honestly really good information because it tells you by outcome measure what percentile ranking you are in the nation. It gives you a range, but at least you have some idea. In order for you to come out positive in the calculation of the percentage that will be taken from your payments or added to your payments, you need to be in at least the 51st percentile. So you'll want to keep in mind that any of the outcome measures that are currently calculating at less than the 50th percentile, you definitely need to take those specifically and begin focusing very diligently on how you can improve those scores. This information can be gathered again from the iKey system. Whoever is currently responsible for transmitting your OASIS or gathering CASPER reports should already have access to that system. The first official reports we will receive with the value-based purchasing model will not be until July of 2023. So being able to have this information from CMS to give us some idea where we stand as the implementation of VBP begins is very great information. Thank you all for participating today. We are very excited here at HPS to continue to be able to serve the home health and hospice community. And again, very thankful for all of you. Have a fabulous Thanksgiving week.